Assalamualaikum, I'm Ramdan Tawanasi, and today I will deliver the news about plague attack in European countries. Plague is an infectious disease caused by bacteria Yersinia pestis, a zoonotic bacteria usually found in small mammals and their fleas. It is transmitted within animals through fleas. Humans can be infected through the bite of infected vector fleas, unprotected contact with infectious bodily fluid or contaminated materials, the inhalation of respiratory droplets, or small particle from a patient with pneumonic plague. From 2010 to 2015, there were 3,248 cases reported worldwide, including 584 deaths. Historically, plague was responsible for widespread pandemics with high mortality. It was known as the Black Death during the 14th century, causing more than 50 million deaths in Europe. Nowadays, plague is easily treated with antibiotics and the use of standard precautions to prevent occurring infection. In recent decades, an average of 7 human plague cases have been reported each year in the range of 1 to 17 cases per year. The highest number of cases was recorded in 2006, which recorded 17 cases, while the highest death cases were recorded in 2015, which recorded 4 death cases. Our next speaker, Nurul Izzah, our scientist, is going to talk about the symptom, diagnosis, and treatment.
Thank you. So I will talk about symptom, diagnosis, and treatment. First, we go to the symptom. There are 3 symptoms. First, bubonic plague, septicemic plague, and pneumonic plague. Bubonic plague, the incubation period of bubonic plague is usually 2 to 8 days. Patients develop fever, headache, chill, and weakness, and one or more swollen, painful lymph nodes. This form usually result from the bite of infected flea. The bacteria multiply in a lymph node near where the bacteria enter the human body. Second, septicemic plague. The incubation period of septicemic plague is poorly defined but likely occur within days of exposure. Patients develop fever, chill and extreme weakness, abdominal pain, shock, and possibly bleeding into the skin and other organs. Skin and other tissue may turn black and die, especially on fingers, toes, and nose. And lastly, pneumonic plague. The incubation period of pneumonic plague is usually just 1 to 3 days. Patients develop fever, headache, weakness, and a rapidly developing pneumonia with shortness of breath, chest pain, cough, and sometimes bloody or watery mucus. Pneumonic plague may develop from inhaling infectious droplet or may develop from untreated bubonic or septicemic plague after bacteria spread to the lung. Okay, next I will talk about diagnosis and treatment. Diagnosis is made by taking samples from the patient, especially blood or part of a swollen lymph gland, and submitting them for a laboratory testing. Once blood has been identified as a possible cause of the illness, appropriate treatment should begin immediately. Antibiotic and supportive therapy are effective against plague if patients are diagnosed in time. Okay, we go back to the studio.
Thank you, Izzah. Our next speaker, Wan Nurfar Faizana, our ecologist, is going to talk about ecology of virus and transmission to human.
Thank you, Nabila. Now I will talk about the plague ecology. The bacteria that cause plague is Yersinia pestis. They maintain their existence in a cycle involving rodents and their fleas. Plague occurs in rural and semi-rural areas, primarily in semi-arid upland, forests, and grasslands. Wild carnivores can become infected by eating other infected animals, such as ground squirrels, chipmunks, mice, and rabbits. Scientists think that plague bacteria circulate at low rates within populations of certain rodents without causing excessive rodent die-off. These infected animals and their fleas serve as long-term reservoirs for the bacteria. This is called the enzootic cycle. Enzootic cycle means a disease or maintenance transmission cycle occurring continuously among non-human animals in a particular region or locality. From time to time, other species become infected, causing an outbreak among animals called an episode. Humans are usually more at risk during or shortly after a plague episode. Next, plague bacteria can be transmitted to humans in the following ways. First, flea bites. Flea bites that carry the plague germs can spread the plague to people and animals who go to the areas where rodents have recently died from the disease. Dogs and cats may also bring plague-infected fleas into the home. Second, contact with contaminated fluid or tissue. Humans can become infected when handling tissue or body fluids of a plague-infected animal. For example, a hunter skinning a rabbit or other infected animal without using proper precautions could become infected with plague bacteria. The first and second transmission may commonly result in bubonic plague or septicemic plague. Lastly, infectious droplets. When a person has plague pneumonia, they may cough droplets containing the plaque bacteria into the air. If these bacteria-containing droplets are breathed in by another person, they can cause pneumonic plaque. Typically, this requires direct and close contact with a person with pneumonic plaque. Now I will pass back to Nabila.
Thank you, Farah. Our next speaker, Ainul Naziha, our health workers, is going to talk about its prevention.
Thank you, studio. So, my name is Ainul Naziha Binti Razi, one of the health worker that works here. As you guys have heard about the plaque, or we call it as black death. So now we continue on how to prevent the plaque. So first of all, we must reduce rodent habitats around our home, workplace, or even recreational areas. Remove brush, rock piles, junk, cluttered firewoods, and possible rodent. Food supplies such as such as pet and wild animals to make our home rodent proof. So secondly, wear gloves if you are handling potentially infected animals to prevent direct contact between the skin and the plaque bacteria. Next is use repelling if you are exposing to rodent fleas during activities such as camping, hiking, or working outdoors. So lastly, keep fleas off of pets by applying flea control products because animals that roam freely are more likely to have a chance to come in contact with plague-infected animals or fleas. So that's all from me. I hope that you guys have learned something, and I'm going to pass this back to the studio.
Thank you, Naziha. So this is our findings on this research.